here with another episode of Conversations and Connections. We're the official podcast of the Family Crisis Center of East Texas. I'm Stuart, the Prevention Coordinator for the agency, and today we're going outside the agency a little bit, talking with Sharon Kruk, who is with the Coalition. Thanks, Sharon. I appreciate you accepting the invitation.
Absolutely. Happy to be here.
Well, I appreciate it.
Yeah, we're glad to share our mission with you.
Well, and that's awesome. Of course, I know Sharon from being with the interagency meetings and other, we kind of same circles a lot of times. And so I do want to talk about the Coalition. The name itself opens it up. It's I don't want to say it's vague, but it's okay, the Coalition. I guess, what exactly is the Coalition, and what is y'all's purpose in the community?
Yeah, great. I mean, it's a great question, and the Coalition has actually been around since 1988. So we've been here for quite a while, and we are a substance abuse prevention organization. Okay. So a lot of times people think immediately when they hear substance abuse prevention, they think of ADAC. And we do a lot of things with Alcohol, Drug, and Drug Abuse Council. But the Coalition is a little bit different from ADAC in that we focus really way upstream on prevention. Mm-hmm. And we try to look at prevention measures that, in our lingo, are called environmental measures. And basically what that means is just big picture things that we can do that will affect a large swath of the population rather than just small, maybe groups of kids or, an individual or things like that. So the best example I can give of probably something that a lot of people know us for is our work in the smoke-free Lufkin citywide ordinance. So rather than going around to individuals or businesses one by one and working with them to, pass a smoke-free policy, which we do that, but the more effective time, money, all that resources measure is to have the city recognize that protecting the whole city from secondhand smoke all at once with a citywide ordinance, that's really the best route. And so that's the best example I can give you of the types of things that the Coalition does.
Let's talk about the smoke-free Lufkin. How was that received when the Coalition first brought this up, and there was talk about this happening? Did y'all get any pushback from the community? How was that?
Yeah, absolutely. Anytime you're talking about any kind of city ordinance or regulation or any policy, even. I mean, we all know that just from a human resource standpoint. When you have to put in a policy, something's not going well, you know?
Right.
So of course there was pushback, but we are very lucky and blessed in Lufkin that we have city council and city manager and mayor at that time, especially, that were forward thinking and realized that, hey, this is going to affect the health of our community for many, many years in the future. And so, we also had an amazing champion, Dr. Sid Roberts, who worked very hard at building a coalition of people that came together for that smoke-free Lufkin ordinance. So, that is a feather in our cap in that we were kind of behind the scenes on that and helping organize that. But you're always going to have pushback.
Sure.
For public health measures, obviously in the area that we're in right now, you see there's always going to be pushback. But we, as public health professionals and prevention professionals, we have to know that sometimes we have to do things that are going to be for the greater good, health of our community.
I guess it kind of reminds me when I do our prevention work, I've literally had men come up to me and say, "Well, you're telling us we can't look at pretty girls."
Yeah.
I'm not saying that, but there's a proper way and there's a respectful way. Mm-hmm. And going back to the smoke-free Lufkin, of course, I'm at the age now, and I think a lot of our young people probably will never know when you go into a restaurant, that question, smoking or non-smoking.
Oh, absolutely. Yes.
Where do you want to sit?
Smoking on an airplane or,
Right.
Things like that. Yes. Those things have really been stamped out. And we're fortunate because of that.
Right.
You look on the other side, unfortunately, our youth are now being targeted with e-cigarettes, Juul, puff bars, and the like. And, so our priorities sometimes have to change from traditional smoking and tobacco to, whatever the industry is going to put out there to try and attract our youth.
Sure. Well, let's talk about youth. Probably one of the group that if we do anything with a lot is going to be the Drug-Free All-Stars.
Absolutely, yes.
Let's talk a little bit about the Drug-Free All-Stars and these kids in Angelina County.
Yes, amazing group and program that we've had almost since the inception of the coalition. And really what it is our organization believes in the power of youth and the power of youth voices specifically. And so this program started a very long time ago and has evolved over the years. Right now, the program is for high school seniors that apply their junior year, and these are kids in the community from all across Angelina County that are passionate about being drug, alcohol, and tobacco free. And they fill out an extensive application. They have to have references. They have to come in for an interview. And then we narrow down the selection and we choose our all-stars each year. And then those all-stars are really the face of the coalition. We train them at our annual training meeting in August, and then we send them out into the community. They go and visit different organizations in the community. We have an annual visit here at Family Crisis Center. But more importantly, they represent us at health fairs. They were instrumental, the group of all-stars, when Smoke-Free Love Gun happened. They were instrumental in providing testimony to our city council members and going to visit their city council members. So they really, we look for any kid that is interested in being a kind of role model for not only the community, but for their peers, to show that having a drug, alcohol, and tobacco-free life is, it's a great life, and it's preferable than any other option.
Well, what are some of the projects that they're involved in? I know Abby, who's with the coalition, who I really communicate a lot with, is always talking about them going to the grocery stores and putting the stickers on the beer.
Yes, Project Sticker Shock.
Yeah.
Yes,
yeah.
That's probably our biggest, most well known, because that happens every year. We traditionally do it the week before spring break. The all-stars go out and they visit grocery stores, convenience stores, anywhere that sells alcohol, and they it's really a campaign to get the word out to adults not to supply alcohol to minors. And they put stickers on the different packages of alcohol. We have a great partnership with Berkshire Brothers and Biggs convenience stores that allow us, to go in and do that. And it's just a way to remind the community, hey, we don't provide alcohol to our minors here in this community, and here's the consequences of if you do.
Sure.
So
sure.
Last year we actually added another time of year. We usually do that in the spring, right before spring break. It's a timely time to do it. But this year we also did it in the time mid-December before the holidays.
Right.
We found that that's another time that is a good time to remind folks about being responsible.
Right. One thing I want to ask is related to the coalition's work, and I don't know if this will happen in Texas anytime soon, but more and more states are starting to legalize marijuana for recreational use. I guess, and like I said, that hasn't happened in Texas here yet. I don't know if or when that will happen, but what do you think about that?
Well, as youth prevention workers, we know the research shows us, and our surveys of students show us, that as marijuana is legalized in other states across the country. We know, yes, it's not legal here in Texas, but our surveys show that as other states legalize, it becomes normalized. And if it's normalized, then our youth think it's okay.
Right.
And so we have seen that on our student surveys, that the perception of harm or risk surrounding marijuana has gone down. And that is not what we want to see. We want to see that, risk and harm stay up there, especially for our youth. And that's because we know that our young adults, their brains are not fully developed, not done cooking until, almost mid-20s now, the research is showing us. And so if you expose a young person, one in high school and some even young as middle school, to any kind of substance that will affect the pathways in their brain, then you are setting them up for a higher risk of addiction on down the road.
Yeah.
And so we are very closely watching what happens in Texas surrounding marijuana. And we are, as an organization, and especially our board of directors, they are very plugged in to watching what is happening in our state legislature to make sure that we can advocate and we can educate surrounding that. Because I think there's just an unintentional consequence that when you legalize, people just don't think about what that message sends to our kids.
Right. All right. So the coalition is also in charge, and probably the second thing that I work with y'all with, or I see y'all at is the interagency meetings.
Yes.
Here in Angelina County. Let's just talk about that. Interagency meetings, I guess the name kind of is self-explanatory. It's a lot of different agencies, nonprofits, and such, and try to meet once a month to talk about things going on within our agencies, I guess, right?
Yeah, it's really, it really was born from kind of the background and the mission of the coalition. Our tagline is coming together for a better community. So we do that coming together under the umbrella of substance abuse prevention, but we also want to help other agencies to, in the rest of the community come together for a better community. And so that's really where it came from. We, along with Burke, way back in the day, worked at coordinating these interagency meetings, and it's loosely called the Interagency Coalition. There's that word again, the coalition. It just gets thrown around everywhere. But really, the point of it is to have a gathering time, specific time, because we're all busy, but a specific time each month. And in our case, it's the third Tuesday of every month at 1:30, where any social service nonprofit provider in Angelina County can join our meetings in person. We prefer, but here lately have been by Zoom.
Yeah.
And they are able to. We usually have a speaker that shares about, whatever program is happening at their agency. And then everybody has a chance to make announcements. Yeah. So we get to hear about Your Safe Coalition. We get to hear about things that are happening at, at Burke, at the Salvation Army, that we maybe wouldn't otherwise know, because sometimes we get siloed in the nonprofit world. We get so head in the sand in our own area of expertise that we don't know what's going on. So this is to prevent duplication of services, really.
Sure, right. Yeah. I was going to ask you, how has COVID affected these meetings, which I know and you know.
Yes.
But I want to expand on that and just talk about the coalition in general and the drug-free all-stars, and because so much of what these kids do is going out in the public, and by the way, they always help us. Well, they come here every year and they take a tour of the safe house and we do a presentation for them. But I know the past several years during October, Domestic Violence Awareness Month, we have some things going on at Angelina College. And a lot of times those kids will come out and help us do our obstacle course and things like that. But how has COVID just affected the coalition's work?
Like everyone, it's been challenging. I think for us, it's been specifically challenging because our whole mission is getting out into the community.
Right. Yeah.
You know, prevention work, that's what we center on, is the community. So, it's been challenging. We have worked really hard to find, you know, alternative ways to reach out. Lots of Zoom meetings, lots of social media campaigns that our youth have put together, doing things on Instagram and Facebook, and just, you know, finding other ways to get our message out there. Last year's class of All-Stars, they... I'm sure they would say that it was a good year, but for us, it was disappointing just because we didn't get to do the in-person visits that we normally do, and the health fairs and the, you know, just all of the different outreach events. We got to do a few. Anytime there's anything outside, we jump on it. Yes, outside, let's do it, you know. But yes, it's been challenging. I think, you know, for interagency meetings, that would probably be the one place that I would say that, you know, maybe really hasn't affected, because we've had good attendance and sometimes even better attendance on our Zoom meetings for interagency. So that's been that's been good, but that you just can't replace the in-person, face-to-face networking.
I agree 100%. You know, and I think the work we do, and you may agree with this, when you do prevention work, there's just something about having the interaction. I think more people, especially young people, are more likely to speak up and ask you a question when you're talking to them in person, as opposed to talking to them in Zoom, which kind of just winds up being a lecture to them, I think, sometimes, and you do miss that interaction.
Yeah, and they end up, you know, they've been Zooming for their classes, and for, you know, just for so much that they'll turn their camera off, and you just wonder, are we reaching you? Are we getting you? But yeah, that face to face, you can't replace it.
Right. Before we move on, I also want to mention that the coalition, y'all have a podcast as well.
We do.
Right?
We do. I think we launched probably about the same time y'all
Maybe
did.
so.
Yeah.
Maybe so.
Yeah. So JP Heath with our organization, he has a part-time gig also with us, and then his actual full-time job is with Rice University as a sports announcer. So he's got the radio voice already.
Oh, yeah. Sure.
And so we nabbed him to be able to start our podcast. It's called the the Coalition 936, Coming Together for a Better Community. We usually publish that about once a month. Okay. We try to center it around, you know, different things maybe that the All-Stars are doing that month, or around health observances that are happening, you know, that month. We have different guests that come on with JP, and he does a great job at interviewing and pulling that information out, just like you do, Stuart.
So, I don't know if this is an easy question, but what's the one thing that you believe that you're the most proud of in your work with the coalition?
Yeah, I've been there over 7-8 years now. So there's a lot of things that I'm really proud of. But when, you know, you sent me these questions ahead of time, so I had a chance to kind of reflect and think.
Don't tell everybody my secrets.
I guess I shouldn't. Yeah, I shouldn't say that. The behind the curtain secrets of the podcast. But, you know, thinking back and reflecting over the years, so many things. But I think any area where we have youth that are able to shine are the times that I am most proud of. So, two things come to mind in particular. One is that our Drug-Free All-Stars have an annual meeting. So these are new All-Stars every year. You know, we rotate every year. There's new group of seniors that comes in. But every year we pick out 5 or 6 of them that go and meet with Trent Ashby, Representative Ashby. And they get to talk with him about the issues that they see in their schools, and get to talk with him about ways that they would like to see the state, you know, respond to those issues. And gosh, to watch those kids sit down, you know, either in person, or this last year we did it by Zoom, to, you know, get their thoughts together and, you know, be courageous enough, you know, for all of us, we know that Trent's not an intimidating figure. We all, love and appreciate the work that he does for East Texas. But for them, meeting with an elected official is a big deal.
Yeah, of course.
And to watch them be courageous and speak up about the things that they believe in, I just am bursting with pride over that. And then to go along with that, in the previous legislative session, not this past one, but the previous one, we had youth that really rallied around the Tobacco 21 initiative, which was the initiative to raise the sale age of tobacco from 18 to 21. And we had youth that went up to Austin and visited every single representative and senator's office in Austin to share information about Tobacco 21 and to educate about that. And then we had youth that on their own time and their own money went and testified before the different committees, the Senate and the House committees that were considering that measure. And, that it passed. And I think that our youth were a part of the reason that it passed, because they, showed and talked to those representatives and made them understand that if you can raise the sale age of tobacco, you're knocking that whole high school demographic out of being able to provide, because 18-year-olds could buy the Juul and the Puff Bars and the cigarettes and the dip and give it to their freshmen and sophomores on campus, not to mention kids at the middle school. So when you move it to 21, you're knocking out that whole, high school age group. And they saw the value in that. Our representatives saw the value in that. And, we're proud of Texas for doing the right thing on that. And I'm proud of our youth for speaking up.
Great. Okay, so let's get to know Sharon a little bit. Are you from this area?
I am not.
Okay.
I have been here approaching 20 years, and I'm still an outsider.
Okay.
If you weren't
it's
born
kind of like me, yeah.
I know, if you weren't born and bred in Lufkin, although I've done my best to integrate into the community, sometimes I think, gosh, I'm still not there yet. Almost 20 years, but do love this area. We've been here, like I said, almost 20 years, and raised our kids here, and it's been a great place for our family.
So where are you from?
I'm originally from the Clear Lake area, south of Houston.
Oh, okay.
Yeah, my dad was an engineer at NASA, so that's landed us.
Really?
Landed us down there by the Johnson Space Center. So
you know where Aldine is? Okay.
Yes. So is that where you're
That's
from?
where I went to high school in Aldine ISD.
Okay.
And, right by the big airport, as we used to say.
That's right.
Back in the day.
Yes, that's right. The big airport.
The big airport. So where'd you go to school?
Went to Texas A&M.
Okay.
A whoop out there for all of our Aggie listeners. Went to Texas A&M, thought that I was going to be a lawyer, maybe, and majored in political science. And then I decided, my mom was a teacher, and I decided maybe I ought to get my teaching certificate just in case, and ended up loving that and ended up going into to education as a field. But then when we moved to East Texas, I kind of took a step back from education, stayed home with my kids for a little while, and then really loved the volunteering that I was doing in the nonprofit community, and it really spoke to me and made me realize that I thought that I wanted to stay in that sector. And so started working in the nonprofit sector, worked at the Mosaic Center for a little while, and then landed over at the Coalition, which, things have a way of working out. My background in political science ended up being very useful for the job that I do now.
Right.
Helping our kids and our board members, center around that advocacy and knowing how the political process works. It ended up being handy. So, things end up working out the way that they're supposed to work out. And I am a political science nerd. I love anything and everything having to do with government and politics, which I know turns a lot of people off, but I enjoy the process.
So before we wrap things up, I just want to ask you, going back again to the Drug-Free All-Stars, if there's a young person that is interested, I don't know if this is even the right time. We're recording now. This is probably be next week or a couple of weeks before this, so we're still looking at August. When's the time for a young person to apply or express interest? How would they do that?
Yeah, so the time to start thinking about it is their junior year.
Okay.
And we launched the applications on our website, angelinacoalition.org, on our website in April, generally.
Okay.
And then they have until May 31st to apply. And, there's a whole list of things that goes along with that application process. And then the timeline after that is we do our interviews in person in June, and we make our final selections in July. And so we have our incoming class that's coming in right now. We are super excited about that incoming group. We've got representatives from every high school in Angelina County, including the homeschooling community. So we're really, really excited about this group that's coming in. And we'll train them at the end of August, and then they'll be launched out as our official voice of the coalition starting in September. So yeah, juniors need to be thinking about it. And we do our best to get the word out. We do the traditional media releases, but we also go through the schools, through the counselors. And, it's really important that we look for those kids that maybe aren't necessarily plugged in to all of the extracurricular activities that we all think of when we think of, kids that are involved. We want to find those kids that are passionate about being prevention advocates. Mm-hmm. And so sometimes those are the quieter kids.
Right.
And maybe they're not so plugged in, but they're passionate about those things. So those are the kids that we want to find. So we work real hard at working with the counselors and school personnel to make sure that we get those kids to apply.
All right. Awesome. All right, Sharon Kruk, thank you.
Yes,
thank you so much.
And I said earlier, we're going to have to return the favor. We'll have to have you come over and talk with JP and be a part of our podcast.
That'd be awesome.
Yeah.
That'd be great. Thanks. So if you have any questions about what Sharon and I have talked about, you can, first of all, you can email us. Our email address is conversationsandconnections@fccet.com. And if you feel like you need the family crisis services for any reason, if you feel like you need us, you can reach out to us 24 hours a day, 7 days a week. Our 24-hour hotline is 1-800-828-7233. That's 1-800-828-7233. And if you like what you hear, give us a subscribe. You can subscribe to Conversations and Connections via Spotify, Apple Podcasts, Google Podcasts, or the podcast service of your choice. And as always, remember, be the voice. If not for you, for someone else.